Hello all, this is Priya and you're watching Priya in UK. Today we are going to talk about Osce examination. Osce is nothing but objective structured clinical examination. It is also called NMC Test of Competency Part 2. So let's begin. Since November 2022, Osce has updated a lot. So we are going to discuss about the updated version. Now Osce has 10 stations. So in this 10 station, the first 4 stations are APIE, assessment, planning, implementation and evaluation. And coming to the next 4 station, they are skill station. So you will learn about a bunch of skills, and in that skills you will get 4 skills for your examination. And the last 2 stations are silent stations. So in this silent station you will have professional values and evidence based practice. When you look for this duration, it will vary actually. It can take up to 2.5 hours to 3 hours. It's just because each and every skill stations and API and the scenario based stations has got different durations, so that's why. So I'm going to tell you about one by one. In this API station, assessment takes about 20 minutes. So while you doing the assessment, you'll use the assessment tool like GCS, News, Must. So using these tools, you will assess the patient and you will spend about 20 minutes during this station with the patient. And when you're coming to the planning station, it is a writing station, so where you will write all your plans, depends on the patient's care and need. And when you're coming to the implementation station, it takes about 15 minutes, and in this station you will give the care like giving the medications, drug round, and all these will come under implementation station, and it takes about 15 minutes. And the last one is evaluation station, and it takes about 8 minutes. So all this takes about these durations. So I'll repeat: assessment takes about 20 minutes, planning takes about 14 minutes, and implementation takes about 15 minutes, and the last one is evaluation, which takes about 8 minutes. Let's see about skill station. So in skill station, you will learn around 22 skills while you're practicing OSCE. And in your examination, they'll give you 4 skills for the examination. So it can be a standalone skill station or it can be a pairing one. So if you're doing standalone skill station, it will be 10 minutes and you will get 4 separate skills. But in case of sparring skill station, they will pair 2 skills together, and in that time you will do 2 skills within 20 minutes. So I'm going to tell you about the skills, what are all there and how long does it take. So the first one is administration of inhaled medication, which is also called AIM, which takes 12 minutes. Blood glucose monitoring takes 8 minutes. Catheter specimen of urine, which is CSU, it takes 8 minutes. Fine bore NG tube, which is 12 minutes. Fluid balance chart, which is for 4 different patients, 12 minutes. In hospital resuscitation without fibrillation is 6 minutes. IM injection, which is an intramuscular injection, is 12 minutes. Oral care plan, it will take about 8 minutes. Oxygen therapy, 10 minutes. IV flush and VIP score checking is 12 minutes. Pain assessment takes about 6 minutes. Peak flow expiratory flow rate takes about 8 minutes. Pressure area assessment takes about 8 minutes. Removal of urinary catheter takes about 8 minutes. Subcutaneous injection, which takes about 12 minutes. MSU or urinalysis, which is midstream urine collection and urine analysis, which takes about 8 minutes. Wound assessment takes about 21 minutes. It can consist of it is one of the procedure which comes under pairing with aseptic non-touch technique, which takes about 21 minutes. Administration of suppositories, 10 minutes. Bowel assessment is 8 minutes. Nutritional assessment is 8 minutes. And nasopharyngeal suctioning, which is the last one, 8 minutes. So these are the skill station skills. So you will get in the skill stations. So if you see, these assessment skills are sort of paperwork. So you will need to complete the paperwork for during that skill station. For example, if you get bowel assessment skill during your examination, they'll ask you to complete the stool chart for the patient. Depends on the scenario. I can go in detail about each and every skills if you need them. Please do leave it in a comment so that I can post it in the following videos. So if you check the silent station, in that silent station, as I've told you before, you will have two things to do, which is professional values and evidence based practice. So if you see evidence based practice, you will be learning 14 evidence based practices, and out of 14 you will get one in your examination. So I can tell you those 14s, which is ankle sprain, Asperger's syndrome, bedside handover, cervical screening, cranberry juice and urinary tract infection, dementia and music, diabetes, female myocardial infarction, fever in children, pressure ulcer prevention, restraints, saline versus tap water, smoking cessation, use of honey dressing for venous leg ulcers. So, out of these 14, you will get one evidence based practice in your examination. And moving on to professional values, out of 15, you will get one in your examination. So, they are hospital food, impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, bullying, concealment of bed status, confidentiality, drug error, false representation, falsifying observation, falsifying time sheets, witnessed abuse. So, out of these 15, you will get one in your examination. So, each evidence based practice or professional values will take about 10 minutes. So, in this silent station, you will spend 20 minutes altogether. So, this is about the 10 stations and durations. If you need tips and strategies for OSCE examination preparation, please do leave me a comment so that I'll post it in my following videos. Now we'll check about this OSCE fees. So for full OSCE, you will need to pay 794 pounds, which is usually around 79,000 Indian rupees. So this is non-refundable. So once you paid for it and attended your examination or cancelled your examination, they won't refund this money. Once you get your results, you will get like pass or fail, and they will give you the feedback and remarks regarding your results. So if you want to resit for your examination about 1 to 7 station, you will need to pay 397 pounds for partial resit, which is up to 1 to 7 stations. Just in case, if you need to reset for the full OSCE, which is up to 8 to 10 station, you will need to pay the full OSCE amount, which is 794 pounds. So you will get your OSCE results within 15 working days via your email. So you will have the results which will be shown you pass or fail. So if you pass your examination, you will get an email to say what you have to do after that. So if you fail your examination, they will give you an element which you are unsuccessful of. If you come to UK, you might need to know that which OSCE center you are going to apply for the examination. So you have 5 OSCE centers around UK. So one is Leeds Teaching Hospital NHS Trust. The other one is Northumbria University and Oxford Brookes University and Ulster's University, and the last one is University of Northampton. So in this 5 universities, you will be attended the examination in one of those. So usually the hospital will book your examination and they'll pay the cost for the examination. So it just depends on the hospital policies and practices. So with this, I'll finish my video today and I'll see you all in my next video. Please do like my video.